Okay, so here is the handout that I developed and provided you in the classroom, the Canvas classroom. The most common types of commercial health insurance and a little explanation. So the first one we have is HMO, Health Maintenance Organization. It requires covered individuals to select a primary care physician within the network. And we call this the PCP, so their physician. The PCP must be seen for any health issues other than emergencies. So if there's anything wrong in an HMO, a patient goes straight to their physician, and the physician refers this individual to a specialist only as they see fit and if it's needed. Now, HMOs usually offer the lowest premiums and the lowest out of pocket costs, but they have fewer choices since the patient has to stay in their network, so whoever has signed up to work with them. Healthcare providers outside of the network are not covered. Now, they have a monthly premium, deductible, and their copay really depends on the specific plan and policy offered by the HMO and that is selected by the covered individual. Now, I know we talked about premium and deductible, so the copay is an additional payment that each time the individual goes to see either the physician or a specialist, they pay a little bit of money to cover that visit. So usually copays can range anywhere from $20 a visit to $100. Okay, so we move on and we have the PPO, the Preferred Provider Organization. So like an HMO, PPOs have a network of physicians, but they offer policyholders more freedom and flexibility because they allow them to go out of network and see providers that are out of network. So they have lower copay and greater coverage for in-network doctors and healthcare providers, but again, they allow their patients to go out of network. However, it will cost more. They don't need a referral from their physician to see a specialist when you're with a PPO. And so that's also more freedom and flexibility. So for individuals who are like, look, I have a foot problem, I just want to go to a podiatrist, I don't want to go to a physician before I go to the podiatrist, a PPO is a perfect plan for this type of person. And then the PPO again has a monthly premium, a deductible, and the copay, and they all depend on the specific plan or policy offered by the PPO and selected by the covered individual. Then we move on to the EPO, the Exclusive Provider Organizations. And these require in-network healthcare providers, so no out-of-network coverage, but they do not require a PCP or that physician referral to see a specialist. So you can see they're kind of like this combination of a PPO and HMO. They're usually less expensive than most HMO and PPO plans. And they're best suited for really healthy individuals who don't expect to see or need much medical care in the upcoming year. They have monthly premium, deductible, and their copay also. It really is specific to the plan and policy. Point of service plan is like an HMO. The in-network primary care physician provides most of the services and can make referrals to a specialist as needed. And like a PPO, the out-of-network doctors and healthcare providers are partially covered. So point of service is, again, a mix between PPO and HMO. There's the high deductible health plan. Now, this is when the deductible is higher than most other health plans, at least $1,350 for per individual or $2,700 per family. And remember, this deductible means that the patient will pay out of pocket $1,350 before their health insurance kicks in. However, on the other side, there's lower monthly premiums. So that means that each month they only pay a fraction of what other people pay for their insurance. And so this is really appropriate for healthy individuals who don't think they'll need much medical care and who can also afford paying larger sums of money in case of a medical emergency. Because, you really think about it, and a broken bone and x-rays will take care of that $1,300 really quickly. Okay, next one, private fee-for-service. This is a type of Medicare Advantage, and we'll talk all about Medicare later. And it's part of this plan that's administered by private companies. So only people who are enrolled in Medicare can use this private fee-for-service. In-network healthcare providers are covered. Out-of-network providers, again, are acceptable, but with larger out-of-pocket costs. So hopefully you're seeing this pattern that if you select physicians and doctors and specialists that are in network of any of these health insurance companies, it's going to cost less. Now, with the private fee-for-service, there's no referral required for specialists, and the doctors choose which services will be covered on a case-by-case basis. So only the monthly Medicare premium has to be paid along with copays, and there's no deductible. So that's kind of nice. Then we'll move on to a couple different accounts. Oops, and I notice I made a typo, and I will fix that later. The flexible spending account and the health savings account. The flexible spending account is offered by employers who offer those health benefit packages. So the employers that buy the health insurance group policies, they can also provide supplements like the flexible spending account. And this basically is when the covered employee can elect to have a specific amount of money deducted from their paycheck before taxes. And that money is then placed into a flexible spending account. And so the employee then can turn to the flexible spending account to pay for any of those out-of-pocket medical and dental expenses that they come across, so to pay for their deductible. So this includes their deductibles, it includes their copays, any over-the-counter medications, eyeglasses, medical devices, and on and on. And so I put in italics here a very quick summary. This basically is a way to avoid paying taxes on medical expenses. So it's giving you a tax break if you elect to use this flexible spending account. So this is employee earned money that is not taxed and is specifically designated for medical care. Now, however, if you do not use it within an allotted time, like that year, you lose it. So really, when people do this, they only set aside the amount that is anticipated to be used. And a lot of people will calculate that by their annuals for adults. So like, well, I go to the eye doctor once a year, and I go to my doctor, and I go to this couple of specialists every year and get this checked out, and so I at least have those copays. And then for children who go more often for their regular checkups and immunizations, so they kind of just calculate, well, how much does this usually cost, and I'll put that much aside. The health savings account is very similar, but this complements that high deductible plan. The covered individual can set untaxed income aside to cover their medical expenses. Now, what's interesting about health savings account is that the providers of HDHPs offer it, but so do some banks. Some banks allow you to put untaxed money into a health savings account. So that's kind of nice. All right, so that's this handout.